Welcome back, everyone. We are going to have another conversation with Dr. Laura Saunders, a psychologist at the Institute of Living. And I want to talk to you about high schoolers and college students. A lot of colleges have closed for the remainder of the semester, sent their students home. In terms of high school, there is still some trepidation about what may happen in the weeks to come. What you feel for is really the seniors. I neglected to mention about the NCAA's being canceled and the CIAC canceling high school winter sports championships. All of these things weigh so heavily on students, but especially seniors, and they just feel robbed, and you can't blame them.
They are being robbed, right? So the important thing in a situation like this is to validate, right? Validate, this is not fair. It doesn't make any sense. We just need to kind of validate what's going on. My own son is not going to be able to go back after his second semester in college. These are really difficult times. So the more we kind of validate what people are going through, the seniors, whether you're a senior in high school or senior in college, a lot of the rituals, the picnics and the proms and the last steps and last days and last memories, they're going to be different. And in 10 years, you'll be able to look back and sort of have some lament, but for now, we just need to really validate how difficult it is, hope that there'll be a way to make it up or change it in some way, and do the best that we can.
For people all across the state right now, the financial situation is tenuous. There are a lot of people who are concerned about how they are going to make ends meet amid the coronavirus. A lot of things are closed, and a lot of hourly employees are no longer needed. They may not have sick pay, they might not have family paid leave, and it is just such a challenging situation for them. How do they cope in a situation where they don't know when their next paycheck is going to come in?
So these are difficult times, and I really think the more we can kind of band together. I do worry a lot about, finances. There are lots of families that live not day to day and paycheck to paycheck. To let your state representatives know, let your elected leaders know, as you had the two senators on earlier. We need to let people know what the needs are of the community, the basic needs of the community that need to be met. That's one starting point, to really acknowledge amongst ourselves that these are difficult times, to reach out. I worry a lot about social isolation. I work with a lot of very vulnerable people. I say all the time, social isolation is gasoline on the fire of depression. We really need to reach out to those people who are vulnerable. Take that extra time. There's been all sorts of things. The story earlier by Jeff Flax around, people applauding a nurse at a gas station. We need to take this time to connect with each other. If we can find a positive here, it's putting aside any petty squabbles or conflicts and finding what unites us, that we care about each other, that we're in families and communities and towns, and we need to really help each other.
Like you just said, though, there are people who are struggling with a variety of mental illnesses right now, and there are some people, mental illness or not, they are living alone. And so it's hard enough to quarantine and self-isolate when you have a family of 4 or whatever your situation is. But I can only imagine if you are suffering with depression or anxiety or a myriad of those mental health issues, and then you're living alone. What should people do in those situations?
So we do worry about those people. I encourage us to take personal action, right? That person in your neighborhood who's elderly and lives on their own, perhaps doesn't have any family. Leave them a note. Send them a text message. Let them know if they need some groceries, you're willing to go out and get them. Let's take this time to reach out to each other. Although they're not having services in various churches and synagogues, there are still resources in those arenas that we can access. There's more and more online forums. I really worry about the recovery community, and more AA and NA meetings are taking an online format, which actually is a great way for people to connect, even when they cannot get to that meeting themselves.
I think this has also led to a potential rise in alcoholism because people have a lot of time on their hands and they are going to the liquor store and coming home with a bunch of stuff in hand.
Well, yes, I call that negative coping, right? So in times of stress, we turn to negative coping skills, but right now, we need to turn that around, right? We need to identify the anxiety and the worry and the fear, and we need to find ways to relieve that stress or mediate that stress in some way. We need to do things that make us feel a little bit better. It's okay to go outside and go for a walk, even if you're, walking 3 feet away from someone. Do things that help you feel more connected during this difficult time.
I want to ask you about the people on the front lines, and you're talking about emergency personnel, nurses, and doctors. They are not only just trying to balance their professional lives, but also their personal lives at this heightened time. What counsel do you provide for those people?
So, medical personnel, nurses, doctors, mental health professionals, we are the ones still going to work. But we are generally well equipped. We know how to form together in teams. We need to continue to talk to each other. We need to really let go and release some of the stress and tension, and some of that's through humor. But we need to really find ways to connect with each other. What would be more difficult is if you were a mental health or medical professional and you felt like you were all alone. So we need to connect with each other. We need to identify those stressors, and we need to really validate how hard this is in this era right now.
And if people have one takeaway from our conversation, what would be the best way to self-care in the midst of all of this?
Well, what I'd like to say is that I would like to have a little bit more trust in our ability to adapt to change. We all have this in us. We can do this. We can get through these difficult times. We need to reach out. We need to connect as a community, and we need to help each other.
I keep saying that we are in this together. We are literally all dealing with this and all have our own personal anxieties about the situation. So we really do need to stick together. Dr. Laura Saunders, you bring the zen, and we really, really appreciate it. I think you have helped so many people tonight, and we are very thankful for that.
Thank you, Erin.